everyone, welcome back to my YouTube channel. This is your dear Edith, who is always bringing on your way those wonderful tips on how to build a wonderful family. On today's video, I want to talk about the trending video that has been going on and on in social media for almost a week plus now, about our sister Chacha Eke, her marriage, what happened to her, a lot of lies, a lot of cook stories, a lot of cook and bull stories going on about her and about her marriage. A lot of people who are advising her to quit the marriage and live for the children, and a lot of people advising her to be patient with her marriage and set up things right. I am standing in two things here. Number one, I want to applaud all those that show her love during this crisis. It shows that you guys love her so much and you care for her, and that is why I equally love her and I care so much about her. She's one of the Nigerian actresses that I love so much. I love her physique, I love her prominence and everything. But this issue of divorcing the husband with 3 kids, not with 1 child, with 3 kids, is something that for me, if I close my eyes, I will say no, don't divorce, because what of all these good times that have been going on? So it means that you have been having issues and you don't want to settle those issues. This is one thing that is always happening in some families. They have issues. You don't want to settle those issues. You just want to keep silent over it and be harboring it in your heart. Then you keep on pounding and pounding and pounding and pounding and pounding until it explodes. Please, this is why I'm always saying that in most of my video, we should practice open communication. Because if you are practicing open communication with your partner, it will make you to know when you wrong him and when he wronged you, instead of piling and piling and piling and piling like accumulated food in the freezer that nobody will eat. Then suddenly it gets full and burst out. Please, let us try to practice open communication. Okay? Instead of harboring things, and learn to forgive one another. Forgive. If you don't forgive somebody who offends you, you are not only holding yourself down, you are equally holding that person down. A homie. One of our Nigerian ordinary president, he always said that, let me use a pidgin language, he said, I no gree, now in the tear trouser for back. Okay? Let us learn to agree in one another. Put yourself down. Lower yourself. Explain to each other when you wrong me and when I wrong you. Darling, this thing you do to me, I don't like it. Mommy, this thing you do now, I don't like it. Practicing open communication is very, very essential in marriage. And forgiving one another. Another thing I want to talk about is that I really applaud her, I really appreciate her for speaking out from the hospital. At least it eased the tension. Because I'm one of the persons that hates domestic violence. More especially the worst domestic violence to a woman, to a mother. I hate it so much. I don't know why is it like that in my body. But thank God that she spoke out. She said that the man have never laid his hand on her. Okay? Now she speaks from the hospital bed, which I will show you guys later. She said that finally the doctor have come to her diagnosis, because I learned that she has been on admission for days now. She finally speaks out that she have a medical condition which is called bipolar disorder. Bipolar disorder is not a new case. It's only that we, more especially Africans, we don't take care of our mental health. We don't normally take care of our mental health. You see somebody who is sick upstairs, who have psychiatric issues, psychological issues, the person would decide to keep silent over it and thinking that it doesn't matter or it's not a sickness. I want to tell you here that even depression, severe depression, is a sickness. It's not a sickness per se that you have fever, you have this. It's mental illness. And this can be dangerous to you, and this can be dangerous to others. I really want to appreciate her for speaking out. My video today is not all about she being about to divorce or have already finally want to move on with her life. But I'm pleading with her that she should not do that. She will regret it. Because I've seen a lot of people, probably she have one or bad friend that is telling her, what is he doing for you? After all, you're a big lady. After all, you're getting your own money. Move on and take care of your kids. My dear, it doesn't end there. Children are secondary to marriage. Marriage, the primary aim of marriage is companionship. Children are just secondary to it. Okay? So anybody, those bad friends that are telling you, leave him alone, move on with your life, move on. Are you telling me that those of them that are working with you have never offended you, or you never crashed with any of them? I believe you have. The way that you manage and forgive them, always forgive your spouse. Always. If me that is talking, I am talking, I'm so concerned because I've watched most of your videos where you are talking about marriages, encouraging marriages. Likewise me, my platform is mainly encourages marriages and building a happy home. This is what is my concern here. Some people will say, who is this person? I am one of the people that is so concerned in building a perfect home, in building a happy family. Me that is speaking here, if I tell you that my husband will always like sugar and tea or bread and butter, sometimes we have some squabble. But because I have already known that, I will make sure that I take quietly and settle it. Let it not be even more than 2-3 hours. Okay? Please, I am pleading on my sister Chacha Eke, please, give it a second thought. I know marriage is never an easy game. It's never an easy journey. If I am to tell you that marriage is an easy journey, it means I am a great liar. But sometimes it's good that we close our eyes. Close your eyes. Okay? They say love is blind. We believe it. And marriage is an eye-opener. Even if you open your eyes, you will still close it one side. Because if you want to see everything that is going on in your marriage and want to make it the way it must be, my sister, it won't go the way you planned. Those people that are applauding you now, one day you will look back and you'll never see any of them. All of them are clustered over you now, like how ant is clustering over sugar fluid on the floor. You think that they love you. Give them just divorce. Try the divorce and give them like 1 month. You'll never see any of them around you again. And you carry your cross alone. Please, I don't want it. Now I want to talk about this medical condition that she mentioned that she has been diagnosed of. Like I said, I want to discuss about this bipolar disorder that she said that she has been diagnosed of. A lot of people in our society have this condition and they don't even know that they have it. I am not a doctor, but I just want to throw more light, a little light on this medical condition. This is a psychiatric case. It's a psychiatric condition. How do you know that somebody around you or you yourself have this kind of condition? I know immediately they mention it. Some people are like, yeah, I don't know that she's even a crazy woman. No, it's not. Bipolar disorder can happen to me. It can happen to you. Even you may have it without knowing. I may have it without knowing. But how do we know that somebody have this bipolar disorder? How do you know? The person became extremely happy, sometimes extremely depressed, sometimes anxiety, extremely anxiety, panting, like as if there's something happened, you want to die, somebody tell you a story, you cannot bear it, you just want to burst out, you just want to burst like a balloon. When somebody is in a panic, or sometimes you see them crying for no reason, or sometimes you see the person losing interest on those things that she or he loves so much. You love something and suddenly you just lose interest with no reason. Okay? or you see the person want to sleep all the time, feeling so fatigued, so tired, so dizzy all the time, any little thing irritates him or her, you know that that person have this bipolar disorder, and you have to, these are the signs. This is how, what you see in that person that will make you to know that this person have bipolar disorder. These are the signs. Okay, now I want to talk on the treatment. On the treatment, the person have to, if you see those little signs that I talk about, being over anxiety, over depression, over anything, mood changes, severe mood changes. Sometimes your mood will change and you don't even know the reason why your mood changed. And also I want to say that you have to check your age also. If you are above 45, 50 upwards, maybe this is menopausal syndrome. Menopause is when a woman stops menstruating. They have this kind of similar symptoms like this bipolar symptoms. But for her own case, she's still a very young lady. So I think the best way is what she is doing now, taking a medical treatment, and she have to be referred to a psychiatrist, not only in general hospital. The person have to go for a psychiatric treatment. Okay, it's the psychiatric doctor that will be able to dictate which type of bipolar disorder do you have, because they have bipolar disorder 1, bipolar disorder 2, the psychotomic type, which this one is normally happens so much in adolescents, in teenagers. They want to do something, anything they see, they're so anxious, they're so eager to do that thing. They talk papa like without stop. They have a lot of symptoms. So this particular one happened to them. Okay, it's the doctor that will be able to dictate which particular bipolar disorder you have, because bipolar is in categories. Okay, then the doctor now have to decide whether you have to decide with the doctor together whether to put you on which drugs, antidepressant drug, all these psychiatric medications. The doctor have to decide the particular one to give to that person, and the person should try to be taking it regularly, because it's not good that somebody came to your house, now you are happy, before you know it, very, very happy, before you know it, you are very, very sad, you don't want to talk to anybody, you just behave abnormal. Human being, we are social being. For you to start behaving the other way around, mania, this is why Israel call it maniac. But I don't know if they even know what they are saying, but maniac in Israel means crazy person. Okay, so you have to go for psychiatric evaluation to know if you have it or you don't have it. Don't wait until you have it. But if you see those few signs that I talked about, you will know that it's probably you may have one of these bipolar disorder, and you have to go for the treatment. Okay, and also after the psychiatrists, don't leave the person like that. I believe the doctors know what they will do. The person have to go for therapy, for behavioral therapy. Okay, the person have to go for emotional therapy. The person have to go for few therapy that will make him or her to come back to his or her normal senses and normal behaviors, and to know how to behave when this disorder occur, when episode of it occur. You know how to manage yourself and not to transferring anger, aggression, depression on people. And most of us that is always so depressive, you know that depression is a very severe case on its own. Chacha Eke, I applaud you. I appreciate you so much for speaking out. At least I am here to throw a little light on this disorder. So anybody that know that you have it, or you see that you have the symptoms, or somebody around you, please advise the person to go for a psychiatric treatment. You know, whenever we call psychiatric, people think it's only meant for mad people. No. Even somebody who has anger issues, you have to go for psychiatric treatment. Even those of you that always have one thing or the other, you must go for medical checkup, not only when you're sick. It's only us that we always go for medical checkup only when we are sick. Medical hospitals, all these things is there for you to check, to keep it in check all the time, because they say that sickness and health doesn't have starting, it doesn't have an end. It's like a cyclic. It's like a cyclic. It moves from one end to another. Okay. I want to stop here for this week. Thank you so much. I am still your dear Edith. Don't forget to subscribe so that you get my updates when I upload a new video. And don't forget to share. Like I always say, please don't watch me alone and keep it to yourself. Share me out, let other people hear me and learn. At least today is something special. Let the person know that you have to be able to go for medical checkup, not only when you are sick. Okay, please share my videos, comment on it, write down some comments so that it will help me to know the next video to do. Thank you so much. May God bless you all. I love you. Bye. And those of you watching me, my subscribers, I want to appreciate you so much. Thank you so much for making me to reach 100 close subscribers. I am hoping for more because I need at least up to 1,000 subscribers for me to be monetized. I really appreciate those of you who have already subscribed, and those of you who have not already subscribed, please, as I said in the end of the video, don't forget to subscribe to my channel. Okay, and I want to ask you, what do you think about my new look? If it's okay, because I normally like to have a haircut in the summertime. I love you so much. So tell me in the comment section, what do you think about my new look? Love you. Bye.